Hi, I'm Dr. Mickey Barber with Better Life Carolinas, and I want to talk to you a little bit today about our precision health evaluation here at Better Life Carolinas. I get asked a lot, what's the difference between what you do and what my yearly physical that my insurance pays for at my regular physician's office? So I thought I'd dig into that a little bit. There are a couple similarities. I mean, we do a physical exam, just like you're used to having with your regular physician. That's for sure. Second thing, we do labs, but those laboratory tests are where the big differences start. Number one, your regular physician most likely is only going to order labs that your insurance will pay for. And those are very, very routine, meaning usually they're things like looking at cholesterol, which of course is important and we look at too. Looking at your liver function and your kidney function, important, absolutely. We look at that too. But that's kind of where the similarities stop. So we look at other things beyond that because we're really looking to pick up disease before it happens. Sometimes we pick up disease after the fact, but we really want to be preemptive, proactive, preventative. So we look at some early disease risk markers. We look at things that can tell us maybe if you're pre-diabetic, hugely important. Sometimes we even pick up a diabetes that other places have missed. And I'll get into that in a little bit. We look at vitamin levels, hugely important for seeing if there's any pathology, but most important to see if you're getting the right nutrients on board. And then we look at all of your hormones, and hormones are really important for everything from maintaining bone density, to body composition, to memory, to sexual function, to cardiac function. So those are some of the differences just looking at the basic lab work. Another difference that we have is we want to see how physically fit you are. Some people are physically unfit for different reasons. Some people are very fit. And because we're going to be talking to you about how important exercise is and helping to come up with an exercise prescription for you, we can only do that if we have the basic data about where you are on that whole curve. If you think about it a little bit, so let's say you work out now and you try to hit a particular heart rate when you're doing your cardio workouts. Well, where does that number come from? Typically, it comes from either an equation plugging in your age or a chart, again, using your age. Well, every patient, like me, for example, I'm going to be 64. My physical fitness level is not the same as every 64-year-old. So we're going to be able to pinpoint exactly what your training heart rate should be, what your resting heart rate should be. So then when you're exercising, you're going to get more bang for your buck because you know exactly where you are. Another thing we're going to look at, instead of just having you step on the scale, which of course gives you your body weight, we're going to look at what your actual body composition is, and we do this by really using the gold standard here. So we use a scan called a DEXA, D-E-X-A scan, which gives us your body fat, your muscle mass, your bone density, your visceral fat, so your fat around the organs. It is the gold standard. That is where we start, and that's what we continue to follow. Looking at the pounds on the scale, looking at your BMI, your body mass index, is misleading. For a lot of people, that BMI really has to do with your stature, how you're built, how much muscle, how much your bones weigh. So it's only part of the story. So we think the way we look at body composition gives us a lot more information. One of the most important things I think that we do is looking at your cognitive function. If you look across the board at people 50 and over, the number one concern is, am I going to be able to think? Am I going to have to be concerned about dementia, about Alzheimer's? It's a huge problem in this country, all over the world for that matter. And we dig in and we do a cognitive test right as our baseline. So it gives us a good idea of your visual memory, your verbal memory, your composite, your short-term, your long-term, your processing speed, your executive functioning, all the things that are so key to move vibrantly, energetically, and cognitively intact through the aging process. And then we check that every year. So then we can see, well, you started here, great, but 2 years from now, something's happened. Because we want to jump on that before you're actually diagnosed with a cognitive impairment. So hugely important. There are things we can do about it. The next thing really is we have the time to really listen, and that's huge. I mean, you go into a regular doctor's office and it's not their fault, but they're really getting paid to see the most patients they possibly can. So you will be in our office for between 4 to 5 hours for that precision health evaluation. You'll be working with other members of our team. We'll be doing all the testing, pulling all the information together, listening to you, figuring out what challenges you have, what your goals are about your family history, etc. And then you will spend about an hour and a half with me, sitting down and pulling all that information together. So it's very personal. We give you time to talk, and more importantly, we have time to listen. I want to give you a little example of a patient. It happens to be my husband. We started dating quite a few years ago, 10 or 12 years ago. I've been doing this a long time, so I was already in this sort of practice. And Bob had been getting an executive physical every year. He has a very, very strong family history of diabetes. In fact, his father had to have an amputation because of uncontrolled diabetes. His brother had also had severe diabetes, has an insulin pump in, as a matter of fact. And so after Bob and I had been dating a couple of weeks, I said, we really need to get your labs and let's see where you are. Oh, no, I'm fine. I've been going down to this other executive health clinic and I see them every year. I said, well, let's just get them. So we got his labs back. Now he had a fasting blood sugar, okay? So that looks at one day what your blood sugar looks like. That had been, quote unquote, a little high, and they've been following for years. Well, we like to look at, well, how have you been handling your sugar over the long term? So not just that day, but for the preceding couple of months. And how much insulin does it take your body to maintain that blood sugar? So when we got all that information together, it turns out he was diabetic and he had no idea. And his hemoglobin A1C, which is one of the markers I'm talking about, was almost 7, which is a diagnosis for diabetes. The great news is we found that early. We got it turned around with diet, exercise, and hormone replacement and brought that number down to below the diabetic number. So he feels so much better than he did then, and he's in great physical shape, and he's no longer a diabetic. And that is one of my best examples, because it's very personal to me, how we approach things differently and dig in a lot deeper than you're going to find in kind of a typical, more conventional doctor's office. Well, we are really looking to add 10 new precision patients to our program in April, and there are only so many slots available. I'd really like you to consider to be one of those patients. In order to do that, we need you either to go onto our website, www.betterlifecarolinas.com, and register, or call Tammy at 843-737-2597. We know what we have is really different. We know what we have is long-term to help you live a more vibrant, healthy, and engaged life. All we need you to do is reach out to us. So thank you so much from Better Life Carolinas.